Part 1, Basic Principles. So we will learn some chapters including number 1, Metabolic Response to Injury, number 2, Shock and Blood Transfusion, number 3, Wounds, Healing and Tissue Repair, number 4, Tissue Engineering and Regeneration, number 5, Surgical Infection, number 6, Tropical Infections and Infestations, number 7, Basic Surgical Skills and Anastomosis, and number 8, Principles of Laparoscopic and Robotic Surgery, number 9, Principle of Pediatric Surgery, number 10, Principles of Oncology, number 11, Surgical Audit and Research, number 12, Surgical Ethics and Law, Human Factors, Patient Safety and Quality Improvement. So let's discuss chapter 1, that is Metabolic Response to the Injury. So what will we learn in this chapter? Learning objective to understand classical concept of homeostasis. Number 2, mediators of the metabolic response to injury. Number 3, psychological and biochemical changes that occur during injury and recovery. Number 4, changes in body composition that accompany surgical injury. Number 5, avoidable factors that compound the metabolic response to injury. Number 6, concepts behind optimal perioperative care. So let's discuss basic concept in homeostasis. In the 18th and 19th centuries, a series of eminent scientists laid the foundation of our understanding of homeostasis and the response to injury. The classical concepts of homeostasis and response to injury are: number 1, the stability of the milieu interior in the primary condition for freedom and independence existent. Claudio Bernard, that is, body system act to maintain internal consistency. Number 2, homeostasis, the coordinated psychological process which maintains most of the steady states of the organism. Walter Cannon, that is, complex homeostatic responses improving the brain, nerves, heart, lungs, kidneys and spleen work to maintain body consistency. And the third is, there is a circumstance attending accidental injury which does not belong to the disease, namely that the injury done has in all cases a tendency to produce both the deposition and means of the cure. John Hunter, that is, response to the injury are in general beneficial to the host and allow healing or survival. So next, in essence, the concept of the evolved that the consistency of the milieu interior allowed for the independence of the organism, that complex homeostatic response sought to maintain this consistency, and that within the range of responses were the element of healing and repair. These ideas pertain to normal physiology and mild moderate injury. In the modern era, such concepts do not account for disease evolution following major injury, sepsis on the injured patients who would have died but the artificial organ support. But patients exemplify less of the classical homeostatic control system, signal detector, processor, effector, regulator by the negative feedback loop, and more of the open loop system, whereby only with medical surgical resolution of the primary abnormality in the return to classical homeostasis possible. As a consequence of a modern understanding of the metabolic response to injury, effective surgical practice seeks to reduce the need for the homeostatic response by minimizing the primary insult, minimal access surgery and stress-free pre-operative care. In emergency surgery, where the presence of tissue trauma, sepsis, hypovolemia often compounds the primary problem, there is a recruitment to argument artificially homeostatic responses, resuscitation, and to close the open loop by intervening to resolve the primary insult, that is, surgical treatment of major abdominal sepsis, and provide organ support, critical care, while the patient comes back to the situation in which homeostasis can achieve the return to normality. So what will be the summary for 1.1? Basic concepts: homeostatic is the foundation of normal physiology. As number 2, stress free pre-operative care helps to preserve homeostasis following elective surgery. Number 3, resuscitation, surgical intervention, and critical care can return to the severely injured patient to a situation in which homeostasis become possible once again. This chapter aims to review the mediators of the stress response, the psychological and biochemical pathway changes associated with surgical injury, and the changes in the body composition occur following surgical injury. Emphasis is laid on why knowledge of this event that is important to understand the rationale for modal stress-free preoperative care and critical care. So thank you for listening the chapter 1, metabolic response to the injury, and we will discuss next topic, the graded nature of the injury response, mediators of the metabolic response to injury. Thank you.